Gloucester City Mission and the Homeless Healthcare team are based at the George Whitefield Centre. We provide food, showers, clothes, toiletries, that type of thing, and the Homeless Healthcare team are here to provide that physical health support to meet people's needs.
And the people we see have got multiple complex health needs, and some driven by homelessness and some have driven them into homelessness, and they've often got both physical and mental health needs.
Homelessness is a real issue for us in Gloucester. It's a particular challenge that we can't deal with without support from both trusts and the absolutely essential work that's done by Gloucester City Mission and other VCS services.
When I was asked to take on this clinic, it was to decide whether we needed to make ourselves more available, so offer more appointments, spend more time here. Had to come in and look at what we had and look at what we could do to improve it. So for me, it was a new challenge.
Often the people that we see have drug and alcohol problems certainly have anxiety, really low self-esteem, and their physical problems are often very significant because there's been a delay in them accessing help. The life expectancy of a homeless person is 42.
We know there's a link between homelessness and worse health outcomes in general, so that's what we need to address cooperatively.
In terms of looking at a person holistically and trying to help them to have the best possible life chances, you have to look at all aspects of health. And you can't just look at the physical aspects or the mental health aspects in isolation, you've got to look at them together. What we have seen is much more positive outcomes in illnesses like manic depression, psychotic illnesses like schizophrenia, which are now treatable. What our challenge is making them accessible.
It's very hard to reach that kind of vulnerable group of people that we see in our community, and that joined up working that happens here between Together and Care Services is a starting point for something that could be a lot greater to meet those needs for a whole range and group of people.
If the nurses here feel that someone needs to see me, they might come and talk to me about it, they might tell me things are going on, and equally I share that with my colleagues too. So it really is about working together and seeing what you can do for that patient. Success
is measured in very different ways, and is really wide-ranging. For some people, success is walking through the door. They haven't been involved with statutory services or even voluntary sector services for many years.
For me, it's about getting people to engage. That's what I hope that they will do. They'll come in, they'll see me, and they'll think, yeah, okay, I can work with her, and they'll come back for their next appointment. It's about showing them that people do care and you want to help.